and welcome to From Stigma to Strength, keeping you and your mind well. I'm your host, Nancy Reardon, and we're doing several shows on mental health issues, and Methuen has created a mental health task force, including the police department, the fire department, the senior center, health department, and today we're going to focus on the senior center and seniors, elders in our community. And I'm here with three guests, and they're going to introduce themselves and what they do.
Sure. My name is
your
Ashley
title, I'm sorry.
Shaheen. I'm the director of the Council on Aging for the City of Methuen.
At the Methuen Senior Center.
Correct, yeah.
Karen Frullo, Public Health Nurse for the City of Methuen.
Kelly Townsend, Health and Human Services for the City of Methuen.
So tell me, Ashley,
Sure.
and actually all of you, so in these series we're focusing on different groups in the city and how we can help them, well, not me, but how we can help each other actually get through different mental health issues. So we're going to focus on the elder community today. So Ashley, what do you think, so actually let me ask you this. I know that you're new to the senior center, but I have years of experience working with the elderly and the aging population. What new or emerging health issues, challenges have you been noticing, seeing?
Sure. I think we're still experiencing many challenges from the pandemic, especially isolation and loneliness. Participants, seniors specifically, are still working on reemerging and reintroducing themselves to community. A lot has changed over the past couple of years, right. Especially during the pandemic, the isolation and just changes because people weren't able to get out and about as much as they did previously. So physical decline as well, and that's harder to identify and kind of step back into the community. We've done a lot of outreach to seniors, but there's certainly always additional measures that we can take in terms of looking after our senior community.
So I'm going to ask you, Karen, what do you think are keeping people still in the house, especially the eldest community?
I think they're afraid. I think that we, as a whole, made people very scared to go out during COVID.
Right.
And I think they're really scared. I've been going to do blood pressure clinics at some of the senior housings to get them down, and I advise them to go over to the center and get out and do all kinds of programs that they have. So I think it's just about being scared of being sick.
Yeah, I get it. And Kelly, Karen, let's start with you first. How long have you been, so after so many years of managing nurses and working in the community, why did you decide to become a public health nurse?
So my focus in nursing really was home health care. So I was always in the community for many years. And then when we had the COVID clinics at the Loop, I was volunteering time there, and they lost their nurse, their public health nurse, and the mayor asked me if I was interested, and I couldn't leave where I was working because I was the director, but then I thought after COVID, you know what, I think I will go for that job. So
yeah, big change.
Big change, but I love it.
Yeah, so you met a lot of people during the COVID clinics. Were a lot of them elderly?
It was everything. It was everybody, teenagers all the way to the elderly, former patients. It was really, it was great.
So now, when you saw the senior, because we're focusing on seniors, did they say anything to you like they're scared, they don't want to go
always.
out?
Everybody was saying it. They were scared to go out. How long are we going to have to wear this mask? Are we going to have to get a COVID vaccine every year? Is this new? Is it going to be like a flu vaccine? And of course, I didn't know.
Yeah. None of us knew.
None of us knew. Yeah. But they were scared.
Yeah.
A lot of, just not the elderly though. Everybody was really nervous. Scared.
Yeah, I'm sure. I mean, we all were, and in my family personally, everyone in my family was working still, and I was home alone, so I got a dog.
Sure. A lot of people got a dog.
I had to put my dog down that year.
Aww.
So I'm 6 months home alone. I'm like, I'm getting a dog. My husband's like, whatever. So Kelly, let's get to you. How long have you worked in the human service field?
26, 27 years in Merrimack Valley, and I came to the city 2 years ago to to start a human service program for the city, and during that time, was doing some assessments of what the needs were in the city, and almost immediately came to the conclusion that our most vulnerable population at that time and still right now are the elderly, who, as Karen and Ashley were saying, during the pandemic, if you're hearing constantly, it's not safe to go outside.
It's frightening.
It's frightening.
Yeah.
But, coupled with that, we're also, we found a lot of, we've been going out to homes and finding a lot of people that, home health aides didn't come during the pandemic, or people that were, coming to help do clean outs weren't coming there. So we've run into a lot of elders who, their apartments or their homes are either, not necessarily hoarding, but with
Disarray.
squalor situations,
Disarray.
just because they weren't able to get trash out of their homes, but also, a lot of people who were doing a type of hoarding that was just, when you say that they're not going to have toilet paper, these were real things that were going on that, made, people go out and buy things and to stock up. So a lot of what we've been doing out there is trying to decide, what is something that we can come into somebody's home, or we can work with elders to say, oh, okay, you know what, let's get your services set back up. Karen goes out, Jasmine from our department will go out, and Patrick and Sarah, and meet with folks and determine, okay, is this a quick turnaround for this person? We help them get a little bit of a clean out and, get their services back in place so they're able to live. Or is it a more serious situation that we have to work on
Right,
further?
and sometimes they don't have families to help them, and they're alone, so that must make them feel even worse.
We find that a lot.
Nobody can come to help them.
Right.
So that's kind of heartbreaking. And we did, our first show actually was on hoarding, and how it affects people. So watch that. So Kelly, again, other mental health issues complicate a person's physical health, and I'm going to throw in another one with that. We've heard that you've been conducting wellness clinics around the city. This is Karen, I'm sorry.
That's okay.
How have you used your time in interaction with residents to access the general health of the community?
So during those blood pressure clinics and flu clinics and RSV clinics, just telling them you can go out, it's okay, come down to the senior center.
Yeah.
It's really been rewarding, and it's working. They're coming to the senior center.
Glad. That's
yeah,
good.
it's really good.
I've because I'm elderly too, and being part of the Methuen Housing Authority, I've talked to people and go down to the senior center. You really enjoy it. Well, what do they do? I said, well, just go down there and talk to any one of the girls, and they'll give you a tour. And so I've heard a couple of them have gone and signed up for classes, and they're glad they did. But do you see more people coming in now, Ashley, after the pandemic? Well, you've only been there a few months, so.
Yes, I have a short time so far at the senior center, but we are witnessing an uptick in terms of participation in our programs. And Jennifer Loisel, she's our senior activities coordinator. She plans a multitude of programs to get people involved.
She's always coming up with some great ideas.
She's very creative, and
extremely.
we're always looking for feedback.
Yeah, she'll be on next week or tomorrow.
If someone's interested in something that we don't presently have, we're open to the opportunity to explore it. But I would say, just in my limited time working for the senior center, we do have a high volume of people that come in day to day to participate, which is great, but there's also over 13,000 seniors in the community, and we'd love to see everyone participate in some way, shape, or fashion at the center, whether they're physically or even remotely. I know we're chatting with cable to see if we could have senior center without walls programming for some of our homebound individuals that are unable to come to the
there,
center.
right, because of mobility issues and things like that. So if people don't have rides, I know that MEVA, Merrimack Valley Transit
Yes.
Authority, you can call them, and their services are free through that grant through the state,
Correct.
well, the Merrimack Valley. They could call them, and who else can they call?
So I would encourage
know?
folks to call the center. We can certainly act as a liaison in terms
Right.
of getting folks access to transportation, because we do not want that to be a barrier in
Right.
terms of people coming to the senior center. There's the transportation that you had mentioned, and then we also have a program, the NEAT program, Northern Essex Elder Transit Program.
I can never remember that. I know exactly what
so
you mean.
Cheryl McQuinlan,
Yeah.
she's our outreach coordinator. She manages that programs, and that program, well, actually, it's all fueled by volunteers.
Right.
So if anyone in the community is looking to volunteer for the center, that's one way to get involved, is to driving seniors to their medical appointments within
and
the
it could be
Merrimack
seniors
Valley.
doing it too, driving.
Seniors helping
you know.
seniors.
Yeah, exactly.
Yep.
Exactly. So Kelly, I want to ask you, in your experience working in the community, why is there such an uptick in mental health issues, and what is the driving crisis?
I mean, again, we'll talk about the pandemic a little
Right.
bit, and there are real issues.
Yeah.
So if you're someone who, your whole life was independent, I'm talking in the elderly community that's, we have a lot of people who have been able to pay their bills their whole lives, they work their whole lives, and now the economy, it's a hard economy. And so people that they didn't have to, and this is one of the, if I go back a little bit, when doing the assessment, and I'm having conversations with folks, and they're like, well, I don't know, I can't afford my food or medicine. And this was when I'm like, oh, okay, once we hire a public health nurse, the public health nurse has to, have an office at the senior center, because now these are, this is more of a medical level from our human service.
Right.
So Karen's talked to a lot of people about, okay, we can work on food here, this is, you have to be able to, afford your medicine. But I think that people are really depressed. They can't afford their electricity, they can't afford their mortgage. They've gone into eviction. We've had about 80 people within the last year and a half or so, elders that have been in an eviction process that we've been able to help them out of by, helping them apply for RAFT or helping them apply for SNAP. Even in some cases, Karen and Jasmine, will work with people to, are you eligible for Mass Health, but you're still paying private insurance, doing some of these switches, and, then looking at people's budgets to try to figure out, how is it that we can relieve some of this anxiety around, around their bills and being able to afford, life. We had a woman, one of the first people who I met with. I mean, her husband died 2 weeks before she met with me, and she was already, I can't pay for my bills.
Yeah.
So instead of being able to go through that mourning process, she's worried about, I don't have money for food, I'm not going to have money for my mortgage. Her rent was $900, but, it went up to $1,600. I mean, that's a huge amount of money for people who are, collecting Social Security.
There's a lot of help at the senior center, a lot more than people even know.
Right.
I mean, not, let alone the free tax service that you have, the blood pressure clinic, I told you I didn't get any sleep last night, the blood pressure clinic, and so much more, outreach programs. What other programs that are there that we haven't mentioned?
I would consider the senior center as no wrong door. We operate with a no wrong door policy, so if folks are struggling in any sort of way, I hope they would see the center as a point of access,
right,
and then leaning on the team for providing connections within the community and even greater than the community in terms of other agencies that also provide support. For example, the senior center and the health department, they have such an interconnected partnership in terms of assisting folks. So Jasmine and Karen and Kelly's team, they help people with some of the applications, for example, housing applications and SNAP that you had, Kelly, just mentioned. So there's a host of people at the center ready and willing to assist, but it comes down to the individual and
their specific needs.
Take the step and to
get down there,
to reach out, to call, to come on down. Like Kelly had mentioned, people have a lot of pride, and it's difficult.
It is.
It's
very difficult
to ask.
I mean, it's
for help.
It's the age that they grew up in too, you know. So, you know, take pride in, you know, you build yourself, you build your home, you build your life, and then one day it just comes crashing down. Excuse me. And who do they go to? Well, they can go to you. What support groups are down there? You have a grief support group. What other support groups do you have there? That grief support groups, I mean, that'll help people a lot going through, obviously, grief and their depression. Isolation is a big thing for people. And why don't people want to get out?
Well, I think that, you know, again, we go back to the fear of it, but there's also that, you know, when you're saying with the housing authority, you're telling people just to go out.
Right.
And, you know, if you don't know somebody who's been there or know somebody who is, you know, bringing you to, so Karen and I, and, you know, and now Ashley and other folks in my team, is we've been very public.
Oh, yeah.
So, you know, Karen and I hosted the show, one of the Happy Heart shows at the Senior Center. Right, funny,
hilarious.
But purposely,
Yeah.
you know, to gain trust with people in the community and with the elders, and they, you know, they feel comfortable coming up to me, and, you know, and after that show, I had 3 people come up to me and say, "Oh, I know that you collected food here today. I don't have any food at home. Is this something?" And so again, you know, us making ourselves vulnerable so people feel comfortable to come and talk with us. And I think that this is, you know, something that my team has worked on a lot to make sure that people, you know, feel comfortable in coming out, and, you know, and we want more people to get in touch with us. You know, we do have the energy program, which is a separate program that the city is running for folks who are over 60, and, you know, we're able to help with gas and electricity, or maybe some rental arrears. So if you know, find yourself in a situation where you can't afford utilities or you need some rental assistance, and this is for people 60 and over who fall within the poverty guidelines, the federal poverty guidelines, you know, give us a call. And if you're not sure, give us a call. And we'll let you know. And even if you're not, you know, there are other ways that we can help you. The previous, before the pandemic, there was that brown bag program.
I was just going to mention that,
you know, now that it's called mobile markets, but it's back at the senior center. We have folks. It's every third Tuesday a month.
Something similar to that. Like a mobile food truck that goes to the housing authority as well. We just had a slide up there now about paying rent. If you could put that up, please. I can't afford my rent. And the city, the fuel assistance program, well, it's not the fuel assistance program from the city, but they assist you in getting that help.
Well, we also have, the city also has its own fuel assistance program.
Okay.
That, you know, Mayor Perry set up through some of the ARPA funding. $400,000 was put aside last year through ARPA funding, where we were able to, again, because after doing the assessment and saying, like, okay, if we have 80 people who, you know, who were close to eviction, we knew that, okay, these folks need help. And we wanted to be able to draw other people out too, because, you know, once you're evicted, you're evicted.
That's it.
But, you know, if we can keep people in their homes and work on some of these other issues, whether it's rental assistance or, you know, we've had a couple times where National Grid will come in and make deals with folks, and, you know, and then the city might be able to, you know, help with that as well. So I would very much encourage people who are over 60 and are running into these issues to, to contact us.
Right, right. So we have a slide, the slide that is titled "In the Know." If you could put that up for us. Studies show that more than 30% of Mass residents 65 and older have been diagnosed with depression. At some point in some communities, that number rises to 49% rates. Rates of depression have significantly increased since the pandemic, causing isolation. Older adults fear catching a virus, which forces them to confine and become depressed. Depression due to the loss of a loved one is another big issue we've been seeing more often. Isolation and depression are interconnected. Lack of social interaction, which getting them out to the center, contributes to feelings of loneliness and sadness. Breaking this cycle of isolation and depression begins with connection and support. Let's build a bridge to hope and happiness together. How do we bridge that gap between isolation, depression, getting people out? How do we help them? How do we help them, the seniors?
I think we continue doing what we're doing.
Right.
I know you were talking about that Jennifer Loisel is going to come on,
right?
And with the library and from the rec department, getting people out. We do have some other green spaces and a dog park that's going to be opening up.
Yeah.
Looking at these as, hey, let's get out, let's get physical, let's get to the senior center, making things attractive for people.
Mm-hmm. Right.
I mean, when you're talking about like what kind of support groups do we have, I think that every group is a support group.
Right.
Because, if you're playing 45s
mm-hmm.
and, you're making connections with people, that in a way is it's a support group.
Yeah.
So everything that they're doing is, it's for community, and maybe there's somebody in this group that you connect with and you have other things in common with. So putting people in different groups with different things that they have in common and different interests that they like. Then you might be watching, and hopefully somebody's watching today and they're like, I love to paint rocks. Well, I love to play 45s.
I love her so much.
And they'll,
it's the little things that,
right.
You find happiness in, but. So, Kelly, you can read that, I guess.
You think I can see that?
Okay, Karen?
You want me to read it?
Can you see it?
I can see it, yeah. We have taken steps to do more community outreach. The public health nurse and community health workers have been going out to different senior housings to host clinics, which encourage the residents to socialize and has inspired 58 older adults to sign up and start visiting the center. This duo also provides assistance to homebound residents in addition to working with other departments to offer aid in a range of different situations. The Methuen Senior Center has created a programming, that stimulate and get over 300 visitors weekly, moving with exercise and yoga classes to arts and crafts, music fests and concerts by the Happy Hearts Chorus, as well as bringing together different generations with an Adopt a Grandparent program.
So the Adopt a Grandparent program, I went to that.
Awesome.
I covered, they did a fashion show, and they took items from the thrift shop,
Very
and
creative.
they dressed each other. It was the funniest thing. It was so much fun. And a bunch of the kids participated in that, and I keep wanting to go, and it was canceled last week. I guess
because of the weather.
Yeah, no, it was the instructor.
Yeah.
Oh, right,
The instructor.
The teacher at the high school, Jeff.
Yeah. So I'm gonna go this week because I'm going to ask you guys what you think. I'd like to get a couple of kids on the program with this topic and how they deal with issues in school along with each other, because a lot of kids go through, and we're going to have the school department on next week as well to discuss this, the interaction between the older people, me,
older people,
and the kids from the high school. You guys see that more than I do, and how do they play games and different things? And
it's awesome. Well, the health department had a bingo with the kids at the grandparent, and they loved it.
Yeah, I bet.
They're a great group of kids.
Yeah.
And the grandparents are awesome too, the seniors. But
Yeah.
they're very involved, very engaging. They sit at a table with the seniors.
Yeah.
They don't sit together, they sit
Right.
with the seniors. And it's a blast.
Yeah.
It's fun. Great group of kids.
And they learn from each other too, because things change, and the way kids talk today, are totally different than, I mean, everything was groovy and cool and far out when we were kids. Well, not you, you're young. But now it's like, if my grandkids call me bro one more time.
I know, that's
Dude, bro. I'm like, really?
Bro. Yeah.
Nana, please. But I mean, so they're mixing the two generations, which is so cool.
It is
groovy
cool.
and far out. So
They love it. The
yeah,
kids
they love
it.
They do. And every time I've gone, like I said, I've only seen it a couple of times throughout the years, but they do karaoke, they sing and everything else. But you mentioned the Happy Hearts, and Sue Riccio is the director of the Happy Arts, and she always says, Nance, join, you don't have to sing. No, my kids used to tell me, Mama, please don't sing us lullabies. You don't have to. And they were trying to make me feel better, but I can't keep, please. I sound like a man on the phone, for Pete's sakes. But, so anybody can join that. I mean, if you can hit a note, you can join the Happy Hearts. You know, it's always changing. There's so many things that they laugh, they have fun, and there's about 30, 40 people that sing in that choir.
I think there's 40.
Yeah, a lot.
And people that think they can't hit a note can hit a note.
Can hit a note.
You know, I mean, you saw us sing, right?
But I can hit a note, not Kelly so much,
I had my earplugs in. No, I'm kidding. Took my hearing aids out. But you know, you guys did great. So we're gonna stop right here for a minute and take a 5-minute break, so you guys can like get a water or whatever.
Thank you.
So, and we'll be right back.
What rhymes with great?
Participate.
Where does greatness start? Here, in the classroom. On the diamond.
In the pool. On the field.
Where will your greatness take you?
To better grades.
To more friends.
Yeah! Be great. Participate!
When stress shows up, it can be hard to see. Maybe you can't sleep. Or you feel sad and you don't know why. Or maybe it's worse. Because stress can knock you down. It can hurt your health and your relationships. If you've lost a job, worry about your next meal, or have trouble making it through the day, we can help. Text STRESS to 211-211 to find a solution.
Hi, and welcome back to From Stigma to Strength. And we're here again with our lovely guests, Ashley, Karen, and Kelly. And we're going to continue with where people can get food. So there's 4 places here listed, and the times are listed. And where else? There's the Food Mart. Is that what it's called? Food Mart? Mobile Mart?
The Mobile Mart.
I did it again. I'm so sorry. So it used to be called the Brown Bag Program, but that's just, you know, we'll get rid of that.
Yeah.
So what do they have to do for the Mobile Mart at the Senior Center?
So the Mobile Mart is every 3rd Tuesday of every month.
Every 3rd Tuesday of every month?
Yep.
Okay.
And they have to come and pick it up. If they have a home health aide or a family member that wants to come and pick it up, they can pick it up. The health department goes over to the Lawrence Boys and Girls Club. We gather the food. We bring it back to the center in a specific classroom. And then all the volunteers that I have, we package all the bags together. And then we tell the people what time to come and get it. And we've done it for the last 2 months. It's great. You only have to be 60. It's not income based.
60 and over.
What's that?
You said you only have to be 60, but 60 and over.
60 and older, yes.
I don't catch things often, but I just caught that for some reason.
And like I said, it's not income based. We just need to know your address, your name, and that's it.
Now, at the Senior Center, is for Methuen residents only?
Just for Methuen residents.
And Lawrence has their own, I'm sure.
Yes.
And what types of things are in the bag?
So last month it was a pork roast, sweet
Wow.
potatoes. It was really good. Both months were really good. Apples, eggs, yuca.
What?
Yuca, which is a Spanish vegetable. It looks like a big potato.
Okay.
And I
know
guess
what you
it's
mean.
delicious.
Yeah.
And
there's canned goods. There's you
Yeah.
know, so all the staples.
there was apple juice.
So how much do you have before it runs out? How many people do you accommodate on that?
Currently, there is
Tuesday.
no maximum.
Right.
So we're looking for more people to sign up.
Right.
It's running really well. We have 63 people signed up right now,
Right.
and we're not at our max. So we want people to sign up, come down to the center, or call the center and fill out an application, and every third Tuesday.
It's a very simple application process.
to do that.
There's no discussion of income.
Right,
It's
nothing.
really just a name, a telephone number, and an address,
Right.
and you'll be on the list to receive
Yeah.
food monthly through the mobile market.
Right.
So-
It asks you how many people live in your household.
Right.
So that's one question. But other than that, that's it.
So some people, the older generation, are proud, and they, how do they do that? How can you get them out of that? This food's expensive. I mean, my husband and I went to the market yesterday. It was over $200. It's 2 people in my house.
Right.
All right, snacks for the grandkids. That's not
They're
a
very
lot, but
expensive.
still.
So when we first started it, there was only 30 people. And then as we were packing the bags, everybody was asking, how do I get on?
Yeah.
And then we signed up 33 more people that day.
Wow.
So what I
yeah.
want to say about the folks out there that are proud.
Yeah.
So,
please.
If we don't know what the need is, we can't, I can't go out there looking for other
Yeah.
programs. So the
Right.
data surrounding this is very important. So we've identified, let's say that there are these 63 people that need this food. We're also looking at the SNAP numbers, how many people we've signed up. Neighbors in Need runs the pantries throughout town. I don't know if we still have the slide
Yeah.
up, but they're
How can I get
at the
food?
right.
You mind
at
putting
the-
that slide back up, please?
So all of these paint a picture
Right.
of what's going on in Methuen.
There it is there.
So do I know that there's more than 63 people in the city of Methuen that need this food? I absolutely know that. Can I prove it? Nope.
No.
Because when people sign up, it's just giving us more data.
Right.
So we need these data. So if you think that, you're really helping your community by letting us know what the need is. So if you need food, come ask for it. If you need other help, again, come ask for it because, the economy is horrible. This isn't, this isn't something that people have done. This isn't because people weren't, didn't feel like working, or these are people who their whole lives have been able to afford
Support themselves
to
and
support
take care of their
themselves,
families.
and now, because of reasons beyond their control,
Yeah.
they can't afford things any longer, and we
Yeah.
want to help with that. Our goal, with the health department is, and human services, for people to live happy, healthy lives, and for us to be able to get more programming in town, people really have to help us assess the need.
And that's how the senior center gets their funding. The more people go, and the 2 captains that sit at the front, Barbara and Linda, always tell me whenever I go in there, make sure I sign up, make sure I swipe my
Check
little
in.
that
Yep.
that little key card, whatever. Because if I don't, if I'm just going in there, sitting down and shooting the breeze with you guys, not that you don't work all day, but I'm just saying, like at the end of the
Okay.
day, if I don't sign up, if I walk in that door and nobody knows I'm there, how are you going to get your, funding
Exactly.
or however it works? But so the other thing I wanted to mention is, say if I have a neighbor who's elderly, or anybody, check on them, make sure they're okay. If
Right.
they're immobile, if they can't get out, tell them about the MIVA, the bus rides, the free bus rides. Get them to the senior center. If they can't get there, try and get people there to help them. If they need food, someone else can pick up a bag for them, a food bag for
We
them.
also have Meals on Wheels.
Yeah. Oh, Meals on Wheels too, and they also have Storm bags, Storm boxes.
Right.
And if they can't get there, those Storm boxes can sit in their freezer, and there's instructions to heat it up or whatever. And how else can we help our seniors who are isolated, who are depressed?
Sure,
How
sure.
can we help
I
them?
think the outreach is key, and
Yeah.
community organizing. You know your neighbor better than I know your neighbor.
Right.
So encouraging them to call the senior center to get connected. The senior center offers a sense of belonging for folks, and when they come, for example, every other week to play 45s, like Kelly had referenced earlier, you get to know who comes week to week or day to day, depending on what you want to be involved in and those informal supports that you develop. And then it blossoms into, oh, I hadn't seen Karen at 45's last week. What's going on with her? And it triggers us to contact Karen and check in. So that continuous outreach is so important. And the Meals on Wheels program too for the homebound individuals. We have a team of volunteers through AgeBand partnered with the Senior Center that deliver to over, I believe it's 150 plus homebound individuals in the community. And not only is it a nutritious meal, it's also an opportunity to check in, to say hello to someone who may not have the opportunity to see anyone else that day. So also leaning on our team of volunteers to get the message across that the Senior Center is here for everyone and kind of a hubbub in terms of what's happening in the community.
How does somebody sign up for Meals on Wheels?
Sure. So I would encourage them to call the Senior Center and we can be sure that they get added to that program.
Can you tell us the phone number there?
I have a hard time remembering numbers, Nancy.
Okay.
978.
Well, you're new anyway, so we'll give you a pass.
I haven't committed that to memory yet.
983-3325-8825.
See, mine's on my phone. I just hit that.
Call the Senior Center.
Isn't that terrible?
I can pull out my business card.
So,
all right, so the phone number is 978-983-8825.
Excellent. Thank you. I just lost my train of thought. Can you throw up the slide, please, where it says other resources at the top? Assistance when filling out Mass Health. So these are the other resources that are available at the Senior Center. And do you have a part-time social worker now?
So right now we have a volunteer, Beverly Stovall, and she has her bachelor's degree in social work, and she's been meeting with seniors once a week on Thursdays for case management purposes, and she provides resources and connects folks. In terms of social work, I think the team at the Senior Center and the Health Department has such a long-standing history in town that people feel comfortable reaching out to the team to gain additional information. We are actively working towards advocating for a full-time social worker for the department, and like Kelly had mentioned, it all tells the story. So continuing to encourage people to reach out so we have more of a solid case to advocate for additional purposes at the Senior Center.
And I mean, I know that the show is for Stigma to Strength. And, one of the things that I've noticed with Beverly being there on Thursday is that people immediately wanted to talk to her, which isn't something that you would normally see where people would say, hey, I need to talk to somebody. And so that also, tells us that we do have a need.
You just answered a question I had. Do they open up to her?
And I mean, she could be booked every day, all day. And for me, I'm like, wow, that's great that, people will come in and they'll talk to her. And you know what? And other people know that what she's there for. People know that, people are going into talking with them, and other people want to. It's not seen as any sort of stigma. Because I think that a lot of people are in the same place. Hey, you know what? The world's confusing. We hear this on TV. We hear this on TV. We don't know what, and again, that's another thing with the seniors do is they believe everything that they see on TV and believe everything that you hear on the radio and believe everything that you see on the internet. And, we know that a lot of these things are they're marketing. So when you're hearing about emerging diseases and this and that, these are all things that if there's something to worry about in the community, we're going to tell you. And that's another thing, building that trust in our community too, is it's like we're looking at everything behind the scenes, from food insecurity to emerging diseases to, for the first time ever, we've run our own flu vaccines this year. We're looking at, we've assessed and we're looking at, and that's why we need more people to come out so we can assess more and make a healthier community.
And she's confidential.
Oh, of course, yes.
Absolutely.
Yeah, of course.
Make that clear. She's not going to write a book about,
No.
No.
And I mean,
Kelly's depressed about this and Karen
No.
does that.
Of course
yeah,
not.
no.
I
And
mean,
wanna
people
make
talk
that
to
clear.
all of us all the time,
Yeah.
and there's nothing that.
Yeah, I don't hide anything. You guys know that anyway.
And it's free.
Right.
No insurance. You don't have to make sure that
Oh,
you take
exactly.
the right
Yeah.
insurance. It's free.
Yeah. So, can you put that slide up again? I just wanted to touch on other resources. So, what did we not touch on? They can apply for the RAF help assistance with the RAF program, and you also have Spanish-speaking help, Spanish-speaking assistance as well. Spanish-speaking help. Assistance getting a primary care physician, your blood pressure clinic, which is going great. You said there's a lot of people that go to that.
That's right. Well, we have it on Tuesdays and Thursdays.
Right, and then you go to the housing authority as well, right?
Right.
And you meet a lot of people there, and I'm sure they open up to you. And
Oh, absolutely.
that's probably one of the other times that they get out and talk to people too, because, isolation is not fun. So other resources available, and I found this interesting, the Friendship Line, a 24-hour crisis line for those 60 years and older and adults with disabilities. The Friendship Line is available for seniors to call anytime you are feeling depressed and lonely. Callers will be met with a caring ear from a trained volunteer. So where did this program come from? Is it a Massachusetts only, or is it a countrywide program?
I believe it's countrywide.
Yeah,
Where it came from in the state of Massachusetts, I'm not sure.
right.
But they contacted me and told me about the Friendship Line.
Has it been utilized?
I have somebody that calls it frequently.
Oh, good.
Yep.
And they enjoy it? They get a lot of help from it?
Yes.
So, I just lost my train of thought. So a lot of people use it, and there it is right there,
Oh, great.
the Friendship Line, 1-800-971-0016. So are there things down there that say that this program is available, or this helpline is available?
I have it right outside my office.
So do people come in, like when you're doing the blood, so this program From Stigma to Strength, the stigma of a mental health issue that I know of, if you ever told someone you had a mental health issue, they'd be like, ooh, we're not gonna go near Nancy, she's a little wackadoodle. That's not true.
That's not true.
Well, it is in my case, but
Right.
I'm kidding. I shouldn't joke about that, but sometimes joking about things and making people laugh is good for the soul, and we all know that. But so we want to bring the stigma of mental health issues to providing that person with strength. How would you help someone who came to you and said, "Look, I'm so lonely, I'm so depressed. I lost my puppy, I lost my dog, I lost my, whatever." My family member, my mother, my father, my sister, my brother. How will you help them?
Well, if I can answer this, my first statement that I say to people, if they say that to me, is there's no judgment here.
Of course.
No judgment. If you're depressed, tell us about it. Talk to me about it. Are they on medications? Are they seeing a therapist or a behavior specialist? And I just talk to them. And it's working. People are it's a nice team down at the senior center. And we are opening up One Broadway. We have it's going to be a community resource building that's going to be open to the public as well for residents in Methuen. And it's just trying to welcome anybody for anything that they need. So.
Why do you think there's a stigma to mental health issues?
I think that people have seen it in the past as a weakness, and it's just who you are and it's what you're going through.
Right.
And we all have issues that we're working on daily, and sometimes there's just too many issues for somebody to work on by themselves.
Yeah.
And and it's so if we're and I know that you've had the police on and they've talked about that. There's such and I don't want to say what the percentage is because I'll let them, but it's high of what they go out and it's mental health calls. And it's just so we want to, and with a program that we'll be working on with the police are going to be working on as well, is identifying people in the community that need that help so they're not ahead of time, before they need police help, before they, before they're in crisis. Asking for help is hard. Asking for help is hard.
Yeah.
It's hard also too because people get discouraged because there's not the 1/3 of people who work in the health field and human service field have left after the pandemic. So trying to find a therapist is tough. The city of Methuen is working on getting a system in called Care Solace that the school system's using that'll help the residents of Methuen get a therapist sooner or quicker. It's ask for help. There's no shame in it. We've just together have gone through this horrible ordeal.
Yeah.
And nobody expects everybody to just be okay.
It's hard to bounce back.
It is hard
Especially
to bounce
older
back.
people to bounce back.
Of course.
Yeah.
You've lived your life a certain way for a long time, and everything has changed. And I know that we have a lot of people out there in the world that want to say, okay, the pandemic's over and we don't want to hear about the pandemic. But these, aside from, there are a lot of lasting issues that we can't be afraid of.
Right.
We have to work through them.
And face them.
Right, and face them. And again, that's getting the appropriate amount of people that, we need to know the real numbers.
Yeah.
Do I have, 63 people, 63 elders that need help, or do we have 10,000 that need help? We don't know until people come out.
Yeah.
Do we have, 10,000 people that are in need of mental health help, or do we have 40,000 people who are in need of mental health help? We don't know until people come out, and then we can set programs appropriately to help them.
So if somebody was trying to help, like their parents, all right, and mom, dad, you've been stuck in the house for so long. I know that the spouse, your spouse has been gone for a while, but you've been sitting in on the couch watching TV and just moping around because you're sad. What can I do to help you? I mean, this is like a child talking to their older parent, and the role reversal, we used to take care of our kids, and our kids are taking care of us, and it's hard on the child. It's hard on the child. And how do you help that child of an elder parent when they're trying to get their, hi, Senior Center, my name is Nancy, and my mom has just been moping around. What can I do to help? Because now it's affecting my mental health, and I'm bringing it home to my children. How do you help them?
I think if the parent is mobile, maybe
drive them
the
there?
daughter or son could bring their parent or parents to the senior center for a purpose. For example, blood pressure screenings.
Right. Yeah.
Everyone can benefit from having their blood pressure checked. So making a visit for an intended purpose, and then through that visit, introducing the person to all that we have available at the senior center. And I think the first step in the door is key. So we're so thankful to have a team of volunteers that are pretty much stationed throughout the center, welcoming people in, touring folks around, sharing additional information in terms of what we have happening. But it's difficult to have those conversations, especially if it's a loved one, if someone has gone through a loss. Recently, we do have the bereavement group that meets once a month, and the woman who oversees the group is also available off hours as well. It's not that she's just there once a month, so people have her contact information if they need to reach out to her. So it's everyone's circumstances is just so different, so it's more of those one-on-one conversations in terms of how are you doing with everything, how is your loved one handling things, and through those conversations you can better be able to assess the situation and how you can provide supports to the entire family in terms of the connection.
Do they need to make an appointment or just walk in? either?
We do have people who are more trained in these types of
No,
conversations.
I'm sorry, make an appointment to come see the center.
Oh, no.
No, I'm sorry.
Any time during our hours of operation, Monday through Thursday, 8 to 4, and then on Fridays from 8 to 12:30. Anyone at the desk, the team would be willing to tour folks around. And what I've witnessed too is that some of the participants become ambassadors and are very proud to show off the building to folks who are brand new. So that works out well too.
Your two captains, I call them the captains. Yeah, they're nice greeters. You know, when you come in the building.
Yeah, especially if you've never been there before and you see a friendly face greeting you, you feel more welcome and you want to become a part of what we have happening.
Yeah. So we have to wrap up because that's been an hour. Wow. Thank you guys. So it feels like 5 minutes.
Thanks for having us.
I had so many questions to ask, but we just hit on topic on a lot of things. Give you a couple of seconds. All right, you got a minute or so. Just any closing words? We'll start with you, Kelly.
Again, we want people to reach out.
Yeah.
I mean, we want to be able to assess the situation, but what it comes down to is we want to help you. Yes. It's just like I can say that about my team. Everybody's coming at it from a place of compassion. Yeah. There's no judgment. We want to help you. We want you to be healthy. We want you to be happy.
We want you to get out.
We want you to get out.
Yeah.
Give us a try. Give us a call.
And I don't think I want to meet that one person that says, I've never had an issue. I've never been depressed. Things like that. So, and I want to thank you guys very much for joining us. And thank you for watching From Stigma to Strength. And remember, it's okay to not be okay. And you have a great day. Keep smiling.